Come in.
Hi,
Hey.
Charles?
Yes.
What it is?
Yep.
Nice to meet you. I'm Abby.
Hey.
I'm going to be your nurse today.
Okay.
How would you like for me to address you today?
Just Charles is fine.
Okay, great. All right, Charles. So basically what we're going to do today is we're going to go through history of your heart and your gastrointestinal system, so your abdomen. So I'm going to ask you a few questions to begin. Is that okay?
Yep.
Awesome. All right, Charles. So have you had a history of high blood pressure or cholesterol in the past?
No, on the high blood pressure, slightly elevated cholesterol, but my
Okay.
doctor said it was like good cholesterol.
Okay, good. Do you take any medications for your heart or for your cholesterol or blood pressure?
No.
Okay, good. Does your family have a history of heart disease or heart attack? Anybody in your family? Grandparents, brothers, sisters?
No.
Okay, that's great. And have you ever, or do you often notice pain or swelling in your arms or legs?
No.
Awesome. All right. Do you ever get any tightness in your chest, any fluttering, fast heartbeat?
I had some fluttering before,
Okay.
and my doctor put me on a Holter monitor, I think is what they call it.
Okay.
Anyway, but I mean, it came back fine.
Great. How long ago did you have those
Year and a
issues?
half ago.
And have you had issues since then?
No, every now and then, but they said that the fluttering that I have was normal, that everybody's heart flutters every now and then, and I
Okay.
just happened to feel mine.
Okay, great. I'll make a note of that. All right. And as far as your abdomen and your stomach, do you take any medicine for your stomach, antacids, anything like that?
I'll take an antacid every now and then. But
Okay, but not.
It's not prescription or anything.
Okay. And do you ever have any vomiting or diarrhea?
No.
Okay. Can you tell me about your last bowel movement? When was that?
A few hours ago.
Well, that's great. Would you say you're pretty regular, or have you had issues with that lately?
I mean, for the most part, yeah, regular.
Okay. And do you have a history of chronic conditions like diabetes or hepatitis?
No.
That's great. Now I am going to move on to the inspection part of the assessment, starting with the cardiovascular system. I'm going to inspect the patient's skin for any pallor or cyanosis, which could indicate poor perfusion of oxygen throughout his body. I'm not noticing any abnormalities with that, and his skin is the appropriate tone for his stated race, so I am marking that as expected. I'm also going to be watching his breathing effort as he speaks to me without telling him, and watching the rise and fall of his chest to make sure that those are normal, and also make sure that he's not using any accessory muscles to breathe, and he is not, so I'll mark that as expected. I would also look at his anterior chest and look for symmetry. I'd also look for any visible pulsations, which could also indicate a problem. I would also inspect the patient's jugular vein, which would be located near the sternocleidomastoid on the side of the neck, and the carotid artery. I should not see any pulsations of the jugular vein. If I did, that would indicate backflow of blood from the heart, which is serious. With the carotid artery, I may be able to see pulsations, but I am going to palpate the carotid pulse. So I'm going to use 2 fingers, and I'm going to feel for the carotid artery. Okay, and I can feel it. It's about like a 2+, so that is normal. And after palpating it, I'm going to auscultate the carotid artery. After auscultating the carotid artery and making sure that I don't hear any bruise or whooshing sounds, then I'll move on and auscultate his heart sounds. So if I was with a real patient, I would ask them to remove their clothes, or I'd go under, but I'm going to go over so that you can see where I'm placing the stethoscope. So the main heart sounds that I'm going to be looking for are the aortic sounds, the pulmonary, the Erb's point, tricuspid, and the mitral, which will be just in that 5th intercostal space. So I would start going in a Z pattern. I would start over here for the aortic, and then I would move over to the pulmonic, and then just below that would be the Erb's point, and below that would be the tricuspid, and down in the intercostal space would be the mitral. And also in that mitral space would be where you would measure apical pulse, so that'd be again in that 5th intercostal space to the left. And so I would listen to the apical pulse and just listen for any abnormalities there. After I auscultate the heart and the apical pulse and the carotid artery, I would take the patient's blood pressure. So I would get the appropriate size cuff. I don't have a sphygmomanometer with me, but I would get the appropriate cuff and place it around the patient's arm. First, I would palpate the brachial artery, and that is just in the pit of the bend of the elbow. After palpating the artery, I would put on my stethoscope, and I would put my stethoscope, the diaphragm, right on top of the brachial artery while pumping up the blood pressure cuff to about 180 millimeters of mercury. I would pump it up and then release slowly and wait for the first Korsakoff sound, which would indicate his systolic blood pressure. And then the last Korsakoff sound would be his diastolic blood pressure. So now I'm going to be looking at his upper extremities, and I'm looking at, again, his skin color is normal for his stated race. To palpate the temperature, I would, can you flip your arms over? Use the backs of my hands to feel for an even temperature on both arms. They are warm and a normal temperature on each side. I'm also looking for symmetry of the arms and if there's any swelling, and there's not. I could also press for any edema, but he does not have any edema pitting in his arms, so that's great. Next, I would test his capillary refill, which I would do by pressing on his finger for about 5 seconds, and then release and watch how quickly the color goes back in his nail. It was less than 2 seconds, so that's normal. And I would also test skin turgor, which would be up here. I'm going to pinch your neck really quick, and goes right back down, so he's hydrated, and that is normal. Now I'm going to palpate his radial pulse, so I would go just beneath the thumb and feel for that. If the pulse is normal and strong, then I would count for 30 seconds and multiply it by 2 to get the pulse rate, and if it is abnormal, then I would count for a full minute to get that pulse rate. And I would look at his lower extremities now. So I'm looking at the color of his legs and his feet, and they're the appropriate skin tone for his race. I would look at his legs for symmetry on each side and look if there's any edema. To check for edema, I would press my thumb down into the skin and release and measure how deep the pitting edema is. He does not have any edema, so it's a 0. And I would look for any cyanosis, pallor. There's none of that. The pulse sites for the lower extremities would be the femoral artery or the dorsalis pedis pulse, which I would locate just in between the great toe and the second toe on top of the patient's foot. I would feel for that dorsalis pedis pulse. And the posterior tibial pulse would be just on the side of the ankle, so I could feel also for that one. And after doing that, I would check for capillary refill in the feet. So can you put your foot up? Sorry. So I would press on the great toe, the big toe, for 5 seconds again, release, and look for the color to return to normal. And it is an expected refill, so you can put your leg down. Next, I would move on to the abdomen, and I would first assess with the patient's shirt off. Again, I'm not going to make my dad take his shirt off. But I would look at the skin tone, and I would look for an even skin tone according to the patient's race, and make sure there's no cyanosis, pallor. I would also look for symmetry and contour, making sure there's no lumps or bumps because that would be abnormal. And I would also look at his umbilicus and make sure that there's no abnormal protrusion there, which could indicate a hernia or something like that. After inspecting, I would palpate his abdomen. So I would palpate kind of in the 4 quadrants, the upper right quadrant, upper left quadrant, lower right quadrant, lower left quadrant. So I just palpate. Normally the patient would maybe be lying down, but for the purposes of the video, I'm going to have him sit up so that you can see where I'm palpating. So I palpate. There's light palpation and deep palpation using the pads of my fingers, not my fingernails. I would just lightly, in a circular motion, press and make sure there's no tenderness. Any tenderness?
No.
Tenderness.
You.
Any tenderness?
Mm.
Tenderness?
No.
Okay. And after palpating the abdomen, feeling for any lumps, bumps, or swelling of those organs, I would palpate the liver, which would be up closer to the right side of the patient's body, right under that 5th intercostal space. So I would palpate deep under the liver, make sure that there's no swelling or tenderness.
No.
Finally, I would auscultate the patient's bowel sounds. So again, going in those quadrants, I would start with the right upper quadrant and listen for crackles and gurgles of the bowel sounds, and then I would move over to the left side upper quadrant and compare the sides. I would move to the lower left quadrant and listen, and then over to the right and listen. If they were hyperactive, I may be able to hear them without a stethoscope, and that could indicate just an increased intestinal activity. If I'm not hearing any gurgles or cracks, or they're very prolonged in distance apart from the sounds, then that could indicate underactivity of the bowels, which would be unexpected. All right, Charles, that's all for today. I'm going to get the provider and let him know that you're ready to see him. All right?
Okay.
Nice to meet you.
Nice to meet you.